Over the past 2.5 years, Joy has been working with staff and service users at Cerebral Palsy Scotland on a number of pieces of work, considering how psychologically informed practices can help in promoting overall well-being. Joy is very well connected in the psychology landscape. She qualified as a Doctor of Clinical Psychology at the University of Glasgow. And before that, she studied applied psychology at Liverpool John Moores University. And since she's qualified, she has worked with many individuals across a lifelong span, specialised working with children, young people, their families. And currently, which is why I'm so thrilled she's made the time to come to be with us today, because she has recently been appointed into the clinical tutor position supporting the University of Glasgow in their doctoral training programme for clinical psychology. So as you can imagine, this is an incredibly busy time for her as the new students are returning to university. So thank you, Joy, for making the time to come to be with us today. It's very much appreciated.
My pleasure.
The wonderful thing for us about Joy, one of the many wonderful things about Joy, is that her work spans roles both between the NHS and independent practice. So she can bring a real sectoral-wide viewpoint to her observations and to her work with us. And she has a particular keenness for a collaborative multi-agency approach to benefit people, which I think is so valuable when it's in the context for people with cerebral palsy. So Joy, welcome. I'm going to hand over to you, and then I'm going to jump on in a little bit later for a question and answer. For those who are listening, please submit questions through the Q&A button on your right-hand side. Please remember to, there's a hashtag for social media, hashtag CP Scot Conference. And the other thing I would say is that if you're submitting comments or questions, you absolutely can do that anonymously. We're not going to necessarily read out your name or so please feel free to speak freely, and everything on the chat will remain in confidential to us. Thank you very much. Joy, over to you.
Thank you, Stephanie. Yes, thank you so much for this opportunity to contribute once again to the conference. I had the good fortune to do that last year, and so I'm delighted to be able to come along and join you for part of that today. So I'm also really delighted that we're going to get some time to think together about the mental health and well-being of those living with cerebral palsy. Thank you, Stephanie, for the introduction. You've covered so many aspects that I was going to already share, which is terrific. So yes, so I'm a clinical psychologist, and we are currently in a very busy period at the moment while we're welcoming new trainee clinical psychologists to the University of Glasgow just over this week, actually. So it's been a busy few weeks, but this is a lovely welcomed alternative task to be involved in today. So for those of you that were at the conference last year, I had the opportunity to share with you some of the developments at Cerebral Palsy Scotland that I had been involved in. And for those of you that weren't at the conference then, just to kind of update that for the last couple of years, as Stephanie says, I've had the pleasure of working alongside CP Scotland, and they had been especially keen to consider the wider support needs of those living with cerebral palsy, in particular in relation to mental health and well-being. So today I'd just like to share with you a brief progress report on where things are up to in relation to this work. Could I have the next slide, please? Oh, the next slide again, thank you. Great, thank you. So following on from the excellent BOBATH therapeutic supports, which included physiotherapy, speech and language therapy and occupational therapy that was already being provided by Cerebral Palsy Scotland, the team had grown increasingly keen to explore the wider needs of service users. And in particular, there was an interest in the mental health needs of those living with cerebral palsy, and concern whether this may be an area of need that had remained unmet across the service provision to date. Now, we know that there's a general population prevalence of 1 in 6 people experiencing mental health difficulties across their life. And alongside that, the well-documented relationship between physical and mental health, not to mention the anecdotal accounts that were reported by some of the service users from what was Bobith at the time and their families of the wider difficulties associated with living with cerebral palsy. It really did come as little surprise to hear that those living with a disability or chronic health condition are at 3 to 4 times more likely to experience mental health difficulties such as anxiety or depression than the general population. Could I have the next slide, please? So well-being and the need to understand the interconnected relationships between mental, emotional and physical health was becoming increasingly high on governmental agenda in promoting the health needs of our nation. And in addition, the range of factors that wellbeing was thought to comprise were only too familiar to the areas in which Cerebral Palsy Scotland had some experience in considering when supporting the needs of service users and considering their quality of life. Can I have the next slide, please? Thank you. So just to recap then, for those of you who perhaps didn't hear last year's presentation, this slide outlines the key areas thought to affect an individual's overall sense of well-being. Penumbra published this list of key areas which, along with those that are outlined by the Scottish Government in the National Health and Wellbeing Outcomes Framework, highlights the following broad areas considered to affect an individual's overall sense of well-being. So that includes things like early life, mental health, physical health and their circumstances and situation. At the time of us embarking on a collaborative piece of work together, Cerebral Palsy Scotland were offering a range of programmes and supports that were identified to map across these areas in one way or another. And we concluded then that this provided an ideal opportunity to evaluate the impact that Cerebral Palsy Scotland supports can have on impacting change across elements of these wellbeing dimensions. And this confirmed the appropriateness of us applying a wellbeing framework to the focus of this service evaluation and development. Next slide, please. So last year then I presented on the initial scoping exercise that we undertook, and this sets out the aim of our work in adopting a wellbeing promoting framework across the service practice approach and operationalising the existing work that was being done within such a framework. I'm not going to go back over all the details of what was presented last year, but for anyone who wasn't present last year but's particularly interested in that stage of the work that we did together, I'm sure that we could organise for the presentation slides to be made available for you. However, the key points that were outlined in our preliminary work identified that the mental health needs of those living with CP or their families was impacted, but yet there was limited robust understanding of this, and there was little, no or inconsistent supports across the UK available to consider these wider aspects of living with cerebral palsy that are known to impact the overall sense of well-being and quality of life. So we then committed to formally assessing the needs of our service users using structured measures, namely the IROC, which is developed by Penumbra, which looks at well-being, and the Warwick Mental Wellbeing Scale as well, which has also been well used across Scottish governmental national health and sort of studies that have been published. Also, by committing to repeating these measures throughout the involvement of the therapeutic staff with service users, we were following Scottish Government guidance on the importance and necessity to measure service outcomes routinely and evaluating the added value of the work that was undertaken by Cerebral Palsy Scotland. Next slide, please. Thank you. So all the therapy staff were trained in the use of the measures, and in December last year we commenced using these measures with all new clients entering into blocks of therapeutic support, and that was done initially throughout some of the outreach work. By March 2020 we had a sample of cases from which we could explore emerging themes and the types of presenting difficulties that clients and their families were experiencing from a wider wellbeing perspective. I'll outline these on the next slide. However, just as we were about to embark on repeating these measures to evaluate the impact of the intervention across these wider wellbeing areas, COVID hit the nation and we were all impacted by that. So could I have the next slide, please? So from the cases that we were able to explore the kind of outcomes from, we were able to identify the following themes emerging from the assessments that we'd undertaken to date. So these difficulties identified indeed did map across the wellbeing framework, and they provided real scope for supportive interventions that would be of benefit to individuals living with or impacted by cerebral palsy. And as you can see from this slide, it's really quite far-reaching, the different kinds of areas and challenges that the individuals completing the assessments were able to identify as being additional struggles that they were experiencing or their family members were experiencing whilst living with cerebral palsy. Can we have the next slide, please? So what could we conclude then? The presenting needs that were drawn from this initial sample of cases was indeed consistent with challenges identified across the existing literature and previously outlined by the work that I'd been involved in the previous year. And among the themes arising was a lack of clear pathway for accessing supports for individuals living with cerebral palsy and their families, a need for more specific cerebral palsy specific knowledge and skills in the support services that were being offered to those diagnosed with cerebral palsy. As previously outlined in the work that took place in the previous year, there lacks consistency in service provision that's offered across the geographical areas, as well as the kind of uptake in terms of who was accessing that. So there is indeed an agreed agenda, or an agreed sense, that the consideration of the psychological impact of living with cerebral palsy is particularly important, and an understanding of this might enhance the uptake and outcomes of those accessing wider therapeutic supports at Cerebral Palsy Scotland. Can I have the next slide, please? So in January 2020, the Scottish Government published an update on the commitments in relation to national health and wellbeing, among which are most notably to support people in achieving the following: that service users should have a positive experience of health and social care services and have their dignity respected, that health and social care services are centred on helping to maintain or improve the quality of life of people who use those services, and the wellbeing focus of BOBATH could go a long way, or what's now called Cerebral Palsy Scotland. I'm still sort of getting used to new names here. But the wellbeing focus of Cerebral Palsy Scotland could go a long way to helping actualise the meeting of that particular outcome. Another commitment is from the Scottish Government that those working in health and social care services should be supported to continuously improve the information, support, care and treatment that they provide, and that health inequalities should be reduced, and that resources are used effectively and efficiently in the provision of health and social care. And there is an opportunity to promote clarity and a care pathway where services across third, voluntary and public sector can work in collaboration with one another more efficiently and effectively. And we really felt that the work that we were undertaking could go a long way in terms of contributing to that. Certainly that was our hopefulness. So overall, it was concluded that a continuation of this work that we were embarking on together could contribute to increasing the knowledge of need for cerebral palsy and those affected by it and their families, and inform care pathways perhaps in wider service developments. Cerebral Palsy Scotland have frontline access to individuals who are considered to be at greater risk across the areas known to negatively impact overall health and wellbeing, and promoting ongoing psychologically informed approaches to what we do no longer seems like a specialist interest, but a necessity in improving the wellbeing of those living with cerebral palsy. Can I have the next slide, please? So thank you very much for listening to my presentation. It just provides a bit of an update of where we'd got to with the work that we'd been embarking on. And yes, I'm happy to take some questions, or I think we're going to have a bit of a chat about it. Stephanie, is that right?
Well, I just thank you, Joy, for recapping on that. And it doesn't seem that it was only a year ago that we were standing in Hampden talking about the first phase of our work together. But what a huge amount has happened since then. And I think, certainly in sessions that we had earlier this morning, our research or our work and, for example, Glasgow Disability Alliance's work, both are showing what a huge impact COVID and lockdown and restrictions have been for people with a disability in general, but particularly for people with cerebral palsy. And I just wonder if, from your perspective, what your view is of how service providers in the mental health wellbeing sphere are sort of able to deal with this, or what people, where should people go, what should people do?
Mm-hmm. So I think that as is still, I think in the first 6 months since COVID hit, really, I think that all services have been very much in a kind of crisis response sort of mode, in terms of trying to think about how to kind of address the key needs of those that might be accessing their services. So in particular, from a mental health perspective, that's been an enormous challenge as work has continued, but scope to widen much of that work has been significantly challenged by the restrictions, and continues, unfortunately, at this moment in time to be so. But I'm pleased to say, though, that we are certainly kind of coming out another side of that, where we're starting to think a bit wider again then about the wider scope of what work should be embarked upon. And I think that our collaborative work that we've done together really did identify that, in terms of specific supports for those with CP and their families, was really quite patchy around, sort of across the country in terms of what was available. So to when I think about what's already established or well established in terms of mental health provision in kind of the more sort of general sector, I guess, that in itself was challenged. So then when we think about where there was already a gap, then we're just, I suppose, at a position where we want to kind of just be raising the profile, so that as mental health services kind of come out of this very restricted period over the last 6 months, that we might be able to be kind of really promoting the particular need that we've identified, which is for development of more services targeted at the needs of those with cerebral palsy, that's sensitive to and well informed about the specific needs of cerebral palsy and how that impacts on day-to-day and mental health kind of aspects. And so there's definitely something about those of us who might be able to influence that, having a very much a championing role to kind of be raising the profile, because I think that was certainly something that we'd identified was a gap, really.
Yes, and I think it's come up previously today a number of times. People just not understanding. People who don't work with people with cerebral palsy just not understanding the nature of the condition. And actually, this is something also that I think it's worth exploring, because certainly some of the work that we've done together, I know that you have come across, particularly when you were talking about, we had the frontline examples to themes. And the themes that we drew out was actually how improving physical health quite often also improves well-being. And in our lockdown surveys, we had a huge 54% were, but actually, sorry, in May, 70% of people were worried about declining physical health. And, the GDA was saying that 90% of theirs were worried about physical or mental health. And I think, just exploring that sometimes the other positive thing on that was that we found that people who were well embedded within either a sports program or able to maintain some sort of good physical health were better able to cope with restrictions and things. And I just wonder whether you want to just explore a bit more about the work that we did around, actually, if you like, supporting our therapists, physiotherapists or occupational therapists or speech and language therapists, to understand the importance of their intervention and how that improved health and well-being. Wasn't the primary focus of what we were trying to do. Does that make sense?
Well, you might prompt me a bit as I go through trying to respond if there's bits that I miss out of that. So I think that what we've kind of seen as a nation is that we've experienced a lot more in terms of media coverage about the importance of physical health on our mental well-being, on our overall sense of well-being. And I think the work that we undertook was highlighting and kind of affirming what's been well documented in writings over the years about that symbiotic, that kind of interconnected relationship between the importance of our physical well-being and our mental health, and actually that being bi-directional. So, you know, if one is off kilter, it can impact the other. And I think that, you know, it's been talked about very much mainstream at the moment in terms of trying to promote individuals engaging in kind of, you know, health promoting activity to try to enhance their sense of kind of mental health and well-being that's understood to be impacted because of actually a lot of restriction that's been put in place because of the last 6 months impact of COVID. And I know we're probably all feeling somewhat tired of still talking about COVID, but I think it's a really good example of the kind of wider sort of emphasis that there is on that interconnected relationship. But what we were saying in the work that we were doing before we were hit by this was that we recognise that individuals who are living with lifelong, you know, disability, you know, so very much physical physical needs, you know, then it's absolutely no surprise that actually that there's an increased risk that can have an impact on mental health and well-being, and actually really for us stressing the importance of there needs to be much more support and service around about sort of meeting those needs. And I think that I was really encouraged by some of the pieces of work that I was involved in with some of the therapists along the time that I was engaged with that kind of initial piece, and where you know, by engaging in, for example, physiotherapy and increasing somebody's scope in terms of mobility and sort of or kind of some maybe addressing a bit of pain reduction in some instances, or you know, sort of widened opportunities and has a knock-on effect to sort of lifting mood in terms of maybe sort of at the point of coming into the service feeling, you know, sort of more overwhelmed or kind of less positive about things because in a way things have become more restrictive for the individual. But actually sort of by engaging in the therapeutic work that did address, you know, many of those kind of physical needs, actually that created more opportunity that then has a knock-on effect to feeling a bit more lifted and sort of, you know, sort of mental health and well-being, you know, sort of improving as a result of that. So it's
interesting, isn't it? Because being able to participate, I mean, we did a session on employment before lunch, but whether it's employment or whether it's being able to you know, go on the school trip or whatever it might be, but participation,
yeah,
so important, isn't it? And sometimes there is a physical reason why people believe that participation is not possible, but actually, you know, there are ways around it. One of the things I wanted to tease out with you was you know, the different there are so many different audiences here, if you like, because there are, you know, there are issues for, if you like, adults, you know, with CP, but there are also issues around, you know, we around how parents cope with children, you know, and actually the worries that parents have as they look after their children with a long-term condition, or even actually, you know, again thinking back to our survey, that adults who move back with elderly parents, you know, and the stress for the elderly. So I just wonder if you wanted to say a little bit about the differences you found, you know, in the different audiences that you've worked with, when you've been working with Cerebral Palsy Scotland.
Well, you know, I think certainly from my career perspective, I've worked across CAM services and, you know, sort of a range of services, but I suppose what I wanted to kind of draw from there is that sense of the importance of thinking much wider and systemically about the fact that, you know, sort of that when we're dealing with sort of circumstances where, as you're kind of highlighting about sort of carers' needs as well, like just how important that is, and you know, sort of looking at the audit that was undertaken by CP Scotland. You know, I think it is really kind of stark about how, you know, the sort of the kind of care needs and the kind of impact of maybe either resuming some of those responsibilities or taking on more of those responsibilities. I think everybody's being challenged, if it's, for example, with children, promoting not only their kind of physical well-being, but also kind of where educational elements have come in as an additional kind of responsibility that's had to be assumed, sort of by parents or carers. And I think that I think that, again, it highlights the importance of that we need to be thinking widely. We need to be thinking about all of the aspects that impact individuals' sort of well-being, in the audit. I'm really sorry that I've missed this morning, because I was actually at clinic this morning, so I've not been able to participate in kind of hearing some of the other presentations. But just sort of hearing about again, the two-way relationship between sort of, where individuals with cerebral palsy will feel sort of further concern and perhaps anxieties or worries around about sort of the impact that they may feel that their carers might be taking on in terms of supporting them, as well as carers sort of, and parents and carers feeling, sort of concerned about making sure that they're getting that right and kind of fulfilling all the responsibilities. So again, what we're really sort of seeing is just how far-reaching the kind of need for support is, and therefore thinking widely and systemically is just so important, isn't it?
I've got a couple of questions here from the Q&A thing. So talking about somebody, as you get older, all of us, it gets less easy to be physically active. So the question is, if how important does it then become as you get older to have good networks around you with your family?
Yeah, it's so important, and I think in my role, I'm sort of working, sort of across the age span in terms of not just with children and families, but thinking about adult services and older adult as well. And again, sort of one of the things that's been really sort of stark for us is sort of in mental health services for older adults, again, because we've noticed an acute sort of restriction on sort of scope to make links with a wider, sort of support networks or peers or family members because of restriction. Again, we've seen a negative impact on well-being. And so again, it's just a sort of cross-section of that's highlighting certain really important aspects, that because we've had this cross-section of our existence just now that's kind of taken away some of those things, and we're seeing a negative impact on that, it really reinforces the importance of that. So having good networks round about you, having kind of opportunity to link with peers or go along to some kind of social interactive kind of opportunity, or a designated kind of like support for a particular challenge that you might be experiencing, those things are just critically important for in terms of people's participation.
That actually brings me very nicely onto another comment that, and I'm just going to read it to you because it's written far better than I could say it. But how important do you gauge it is for people with CP to be able to meet in person with others, possibly, and in particular to meet with professionals in person, for example, to address any specific mental health issues? It has been voiced that particularly services like CAMHS are planning to, and they're not alone in this, but are planning to continue to work remotely for the foreseeable future, well into 2021, and particularly thinking of people with communication other than verbal communication. Often much more important to be in a room with someone to gauge facial expressions, behaviour, physical tension, etc. This is an issue we're coming up as Cerebral Palsy Scotland, the remobilisation of services into in person, very, very slow. I'm obviously not asking you to tell us what the COVID restrictions are going to be into 2021, but just, from our perspective, it seems that these are essential services that need to be face-to-face on occasion and can't just be left to remote consulting time.
Yeah, I mean, I guess I would speak from my perspective and colleagues that I'm engaged with in terms of, we too see that there is a priority where it's possible to go back to, or where it's possible and indicated that we should be doing face-to-face, then we too would have that preference to be doing that. And I think we're all at the mercy of, government directive at the moment in terms of, certain elements that still kind of imposes restriction. But I think one thing that I think is important to kind of raise is that in the field, there's definitely kind of a willingness to kind of get back to sort of face-to-face where that is more beneficial for certain individuals. There has been quite a lot written about this, and sort of so we have a number. So one of the tasks I've been involved in over the summer months actually was to review literature around about sort of the delivery of mental health services or psychological therapeutic supports using these remote sort of deliveries, because I think that perspective is very much sort of out there, that actually this is not as good as face-to-face, but actually the evidence base shows some kind of variation in that, with some people stating a preference to see people face-to-face, clients preferring to be seen face-to-face, and some actually preferring this mode and actually increasing kind of like scope where sort of other challenges are around, maybe in terms of accessing services geographically and things like that. So I think there's very much a mixed picture about that. And I think that the evidence base actually does support that this remote delivery still does have benefits for those that it's well suited to. But I think there are elements where we have to work on a kind of more case by case basis, and there will be some, there will be some instances where that's maybe not necessarily so useful. And you've highlighted about communication, and I think again that would be largely dependent on, there are ways in which we can do that using kind of sort of computer aided typing and kind of like doing it almost sort of text, sort of text based, and that can be a way of doing it. But I do wonder if in some of those instances that might be that would feel preferable to meet somebody face to face and be able to kind of personalize that a little bit more. But it's a difficult one, I think, Stephanie, that one.
And actually I'm interested in your reviewing the evidence, because a lot of the evidence I've seen has been pre-March 2020. So I know there was a University of Oxford study on NHS Attend Anywhere, but that was pre-lockdown. So I wonder what would change as we go through this strange and weird year. But I think the other thing that's struck us is that we've worked very closely with you, and you've worked very closely with the therapy team to embed a wellbeing support and within their clinical practice. I certainly think that we get to a point where organisations like ours are able to identify people that really do need some help. Where do we go with them? I think this is our what should professionals or carers do if they identify a mental health concern?
I think that what we should be doing is we should be promoting the kind of channels for referral to mental health services, whether that's through CAMHS or whether that's through adult mental health services, and we should be endeavouring to pursue those routes, on identifying that there is a need there. We know that there are challenges around across the country, and those are wider and bigger conversations than I personally would have kind of influence over. Although I'm sure a few of us would really love to, but but I think that what the recommendation would be is, if you are concerned about somebody and their kind of mental health and well-being, that we need to be having those conversations with GPs and with their, and sort of asking for referrals through to mental health services, and just being very, very clear about what the specific concerns around about their presentation are. Meanwhile, I think there are other opportunities at sort of wider strategic level where, the findings that we've had, the findings that, you've had from CP Scotland from the audit, sort of some of that evidence base really needs, we need to keep pushing that to kind of just raise.
Well, we are sharing as white, we are putting it into government and everybody else that wants to listen to this. And you mentioned in your slides the Scottish Government National Health and Wellbeing commitments, January 2020. I mean, these are great ideals, and it's one of those things that it sometimes frustrates me. It's a bit like the framework for action for people with neurological conditions, which I'm involved in, or the Health Improvement Scotland standards for health and social care and things like that. You know, they're great bits of paper, great ideals, but how can we've been talking about how we develop a pathway for independence. There seems to be such a disconnect between our work on the ground, the ideals of the Scottish Government or Health Improvement Scotland or whoever it is, and the actual reality in the middle.
I think that the work that we were collaborating on together definitely felt like a kind of pioneering kind of piece of work in many ways, and in as much as we'd identified that, you know, that there was limited kind of robust exploration of these kinds of issues. And I think that what our hopefulness was that we would, in a way, sort of be able to set a precedence by adopting the approach that links with what those the national kind of outcome suggestions are, and sort of saying, right, well, we're working to deliver that within the scope of CP Scotland, and here's what evidence that we've got on the basis of doing so. I suppose as a way to be taking additional data and additional kind of evidence to support, you know, sort of you know, the pleas that we're making about the importance of this, you know, to kind of demonstrate that in a very kind of active way about how our hopefulness of that actually taking a wellbeing framework and looking at these different therapeutic approaches, you know, sort of can really have an impact on meeting very specific needs that are being identified but not routinely being addressed.
So are we saying here that, I mean, that all the evidence that we're gathering, be it from our surveys, being it from your work or, you know, the other areas, are a very useful and helpful way to challenge that the policy framework, which seems to be moving in the right direction, is not being delivered? I mean, I think at this point I want to say a thank you to all those participants who have helped us responding to surveys or have come in for discussions or sessions with us, you know, because it really is, that's the way we can make a difference and point out how it doesn't, that these policy frameworks do or don't serve people with
Yeah, absolutely. I think that, you know, in our first year of working together, we reviewed what literature was available in relation to kind of the specific needs associated with living with cerebral palsy for individuals and their families. And we saw that there was a real kind of sort of dearth of what was available, specifically looking at that. And then anecdotally, we were hearing from service users about sort of linking into services where there was a concern about how much sort of CP specific kind of contextual kind of awareness was around as well. And I think that, yeah, absolutely, it feels like, well, we're trying to make a shift here in the work.
I think that's the frustration, isn't it? That services are in silos, and I think this is understood by other areas. But you know, if people don't understand your condition, how on earth are they going to understand what your issues are? Joy, I'm very aware of time. I am so grateful because I cannot imagine how busy you are with all these new cohort of students and all the rest of it. It is, I agree with the comment that meeting online is lovely in one respect, but it is not the same as the welcoming you into the centre and being part of the team. Your desk remains for you when you're allowed to do that again. So,
well,
I can just reassure everybody today that, you know, this is the middle of some work that we are all trying to. Rome wasn't built in a day is always the great saying, isn't it? So, you know, we have pledged to continue this as we can as we move forward. But I really am grateful for you coming on today, because I think understanding the specific issues for people with CP around mental health and wellbeing, particularly at the moment, and actually I think for everybody to know that you are a champion for How do we make these pathways, develop them, and make life better? And that work is going on. It may not be always obvious, it may not be easy, and it may be very difficult, but the policy setting and the evidence eventually, hopefully, will come together.
Yeah, absolutely.
Thank you so much for joining us. Good luck, students. Please tell them about CP and send them our way too. You know, we need lots of CP specialists in Scotland.
You can rest assured that any opportunity I can, I am doing so. So thanks so much for having me along today, and I hope the rest of the day goes well. And I'm sorry not to be able to join for the rest of the day as I'm now move on to my next thing today.
We are very grateful that you could join us for this. So thank you very much.
No problem. Thank you. Bye.